journey that was designed by a local organization called Generate Health. While the idea of that may rightfully intimidate some of us today, the tour did a phenomenal job of painting a picture of the social determinants of health within the context of St. Louis history. For those who are less familiar, Generate Health mobilizes and inspires the St. Louis region to advance racial equity in pregnancy outcomes, family well-being, and community health. I always think it's imperative to take a moment to honor this organization as a true catalyst in the St. Louis region for using a tour-style model to explore social determinants and health disparities in our area. At its peak, the Gemba Tour was one of our department's most successful programs. It was hailed by many as offering perspectives about impacts on health outcomes that many participants had otherwise not been given the time, safe space, or opportunity to explore. However, when the pandemic hit, we were immediately forced to reimagine ways that we could leverage technology, our new medium for connection, to continue the great work of educating our team members on the concepts and content offered through this tour. Born from this necessity was the Virtual Health Equity Tour. George Santayana says that those who do not remember the past are condemned to repeat it. This sentiment is at the core of the Health Equity Tour's mission, to equip our team members with a necessary tool that will help them more effectively, respectfully, and equitably serve our patients and serve beside their peers. When we think about present conversations that exist today around disparities and mistrust that are perpetuated within healthcare systems and institutions, and that also extend to nearly every system and institution to speak of, it is also important to recognize that our current reality is grounded in a history of practices and policies that have perpetually disenfranchised and pushed certain populations to the margins, namely the African American community. The Virtual Health Equity Tour leverages technology to explore mediums like interactive maps, videos, data, and dialogue to specifically learn and evaluate ways that healthcare, education, economic stability, neighborhood and built environment, and social and community context have historically interlocked to create what are known as the social determinants of health. Social determinants of health is defined as an ecological model that puts into perspective the circumstances in which people are born, grow up, live, work, and age, as well as the systems put in place to deal with illness. These circumstances are in turn shaped by a wider set of forces, including but not limited to economics, social policies, and politics. What an exploration of the social determinants of health brings to light is that only 10 to 20% of the factors that contribute to health outcomes are directly connected to our institutional investments or interventions. What this tour insists is that awareness of the remaining 80 to 90% of factors is imperative if we're going to truly understand how people show up and what it means to serve our community members in an equitable way, from recruitment to the provision of life-saving health care. How do we make the most of our individual and collective impact? And how do we find meaningful ways to advocate for equity and belonging in the communities that we live in, work in, and serve? Through this tour, my hope is that we begin to answer those questions together. Feedback for the tour has mostly been favorable. When grouped into themes, many participants walk away with a renewed call to action and a request to make experiences like this one standard for all of our employees, especially leadership. Since the integration of the tour, our department has made strides in advocating for this cause and anticipate making it a standard goal across the system by the end of 2021. Here are a few responses that we've received. This has been a great room for discussion. Lots of information I did not know about St. Louis and BJC's history. So much context about the distrust of healthcare in minority communities. It lit a fire inside of me to do more for our communities. It was difficult to see some of the hard truths about our city and nation's history. Bringing those things to light is very much needed. Honestly, this motivated me to learn more about the history of St. Louis and continue to advocate for candidates of color and hiring them into our organization. Every employee needs this tour. Currently, the Virtual Health Equity Tour is offered in two 90-minute parts. The first part lays a more foundational history about the social and political landscape of the St. Louis region. It also offers a comprehensive look at the history of our nation's healthcare system, as well as some of our very own system and city healthcare history. Part 2 of the tour explores the history and present impact of residential segregation on neighborhoods, economic stability, and social networks, and concludes with an examination of the role a failing education system played in the Ferguson uprising, and what a holistic look at Ferguson, including but not limited to the death of Michael Brown Jr., says about the current state of social determinants in our region and society at large. As we move through the tour, participants are invited to engage through open reflection, as well as the application of their own lived experiences. From lifelong residents to newer transplants, it's been noted by participants that there is something for everyone to learn, contribute to, and take away from this conversation, especially as we strive to establish a culture where everyone belongs and where we are truly upholding our mission to take exceptional care of all people. In the future, we'll also be launching three additional programs. The first being Foundations of Social Determinants of Health. One of the critiques of the Virtual Health Equity Tour was that its length made it not as accessible to as many employees as we would like. And so the Foundations of Social Determinants of Health is a 60-minute foundational introduction that introduces key related terms, as well as the impact of social determinants of health on individual well-being. Social Determinants of Health and Me will be an interactive 60-minute experience that defines social determinants of health and makes room for participants to explore how they personally experience them. The Virtual Health Equity Tour debrief is for those who've successfully completed both parts of the two 90-minute parts of the Virtual Health Equity Tour. It's a 60-minute session that offers an opportunity to process post-tour, as well as explore ways to apply what folks have learned to their personal and professional spheres of influence. All in all, this tour and the forthcoming curriculum has been and will be a valuable opportunity to expose our systems team members to relevant history and frameworks that can be directly applied to how we care for and build relationships with our patients, teammates, and communities, as well as how we advocate in policy, resource allocation, hiring practices, etc., and live out the values of our organization. Thank you.